Hello, I'm Dr. Merle de la Cruz Audi, Chair of the Department of Anesthesiology of the Medical City. The videos you are about to see have been designed to educate the viewer about anesthesia at the Medical City. They highlight not just the excellent services available at the hospital, but also the commitment, dedication, and expertise of our doctors and other medical professionals. Most of all, these videos underscore our department's commitment to enhance patient care and safety through increased patient awareness. When patients know more, they are able to help not just their doctors, but also themselves. Because here at the Medical City, we believe that the best possible health care is achieved when our patients become our partners.
Aside from the result of the operation itself, I'm worried about having anesthesia.
Kasi ang dami ko naririnig. Hindi ko alam kung totoo yun or ano.
They say na baka you might lose your memory.
How long will I be out? Will I still be able to move after?
Actually, kinakabahan ako. Iniisip ko, will I wake up during my surgery?
Are there any side effects with the anesthesia? Will it affect the quality of my life? These are the things I worry about.
It seems ironic that something meant to alleviate pain and reduce patient distress should cause so much anxiety. But the fact is, much of the concern people have about anesthesia stems from the fact that they know so little about it. Or if they do know something, it's in the form of myths or misconceptions. Hi, I'm Dr. Celine Ancheta. In this program, we'll address your concerns about anesthesia. We'll ask patients like you about their experience with anesthesia, and we'll get the facts straight from our team of highly trained doctors. Before we go into our step-by-step discussion of the anesthesia process, we need to answer a few basic questions. What is anesthesia? And what exactly is an anesthesiologist? Anesthesia is most commonly defined as a condition or state of blocking awareness and sensation. It allows patients to undergo surgery and other medical procedures without the distress and pain they would otherwise encounter. Basically, an anesthesiologist is a doctor who administers anesthesia to the patient. But not many people know that the responsibility of the anesthesiologist does not begin or end with just the giving of anesthesia.
The primary role is to make sure the patient does not feel any pain during surgery, to make sure that this patient is comfortable, this patient is relaxed, this patient is not worried, and this patient survives. He wakes up if you put him to sleep, or if you do any of the regional anesthesia on him, he walks afterwards. And he's pain-free intraoperatively and postoperatively, because that's what anesthesia is all about.
Now that we understand what anesthesia is and what an anesthesiologist does, we can go into the first step in the anesthesia process, which is the pre-operative visit. The pre-op visit is important because it allows patients and the anesthesiologist to get to know each other before the operation. For the anesthesiologist, this means learning not just who the patient is, but also getting all pertinent medical information, vital for a safe and successful procedure.
First is we make a pre-op visit. We go to their room so that we can introduce ourselves and get to know the patient.
Before your operation, your anesthesiologist will want to get to know you more. He should want to examine you and do a brief medical history on you. You should be honest with your anesthesiologist and tell him about your allergies, your past or your current medical conditions, the pills that you're currently taking, illicit drug or alcohol abuse, and your past anesthetic experiences. Of course, your laboratory results will also help in you should bring them and show them to your anesthesiologist when available.
Tinanong niya sa akin kung meron akong ibang tinitake na gamot kasi baka magkaroon ng reaction or complication sa anesthesia. So sinabi ko sa kanya lahat, including vitamins and food supplements.
Nakatulong po ng malaki yung pag-visit sa akin ng doktor ko before my operation. Sinagot niya lahat ng tanong ko kung ano yung mangyayari sa akin during the operation, after my operation.
In the case of infants or minors, the doctor talks to the parents or legal guardians.
They have to tell us about the child's developmental history. Does he have other diseases that might have an effect on the anesthetic we're giving? Then other things like eccentricities, idiosyncrasies of the child, like, or maybe he doesn't like going to the operating room or anywhere without his toy or his blanket. Little things like that, aside from the medical history and his physical examination.
One of the things the anesthesiologist discusses with the patient during the pre-op visit is what kind of anesthesia he or she will be receiving, whether it's local, regional, or general anesthesia. Local anesthesia restricts the numbness to a small part of your body. This is usually used for minor procedures like stitching a cut. It can be given via sprays, ointments, or injections. And with local anesthesia, the patient remains awake but does not feel any pain. Regional anesthesia is used for operations involving larger or deeper parts of the body. The anesthetic is injected around a group of nerves that carry signals to the brain, making a part of your body, like your arm or your legs, numb. In regional anesthesia, the patient may remain awake or may be given a sedative. Either way, the patient does not see or feel the actual surgery happening. Examples of regional anesthesia are the use of an epidural during childbirth, spinal anesthesia for prostate surgery, or an eye block for cataract surgery. General anesthesia is a state of controlled unconsciousness. The patient will feel nothing and will be completely unaware during the entire procedure. There are different types of general anesthetic drugs. Some are gases delivered through a breathing mask or tube, while others are injected through a vein. The choice of what kind of anesthesia a patient receives is largely the choice of the anesthesiologist. But in some cases, a patient may choose the kind of anesthesia he or she will be receiving.
The choice of anesthesia will, number one, depend on the anesthesiologist also, depending on the procedure being contemplated. Number two, there is also a choice of the patient if there are more than one options for anesthesia. So the patient might be able to decide on what she wants or he wants for the kind of anesthesia that would be contemplated, only if there are other options.
In the medical city, we empower our patients. They take responsibility over their health care as much as their own doctors. This partnership is born out of knowledge through communication, which is primary, about what they will undergo, and decisions are made as a consensus rather than as a unilateral decision by their doctors.
As with all medical procedures, there are risks with anesthesia. And during the pre-op visit, the doctor explains these risks thoroughly to the patient.
Receiving anesthesia is potentially dangerous, but it is now made safer by the anesthesiologist training and equipment. Serious complications, for example, like paralysis, are fortunately very, very rare.
Sinabi nga niya sa akin tungkol dun sa procedure dahil sinasabi ko sa kanya na hypertensive ako. So sabi niya magkakaroon daw ng risk. So, in-explain naman niya sa akin na kahit meron risk, ando naman daw siya para bantayan ako. So, sa pagkasabi niya nun sa akin, ngayon, medyo naging comfortable naman ako.
After explaining to the patient everything he or she needs to know about the procedure, the anesthesiologist discusses the consent form with the patient.